Hi, do you want to learn about the next chapter in the chapter specific coding guidelines of ICD-10-CM? Don't worry, I got you covered. This is Surya Johnson, your medical coding guide. Hi, sorry for the very late video update. Life got very busy, and thank you for understanding. And in this video, we'll see about the third and fourth chapter. Actually, third chapter, it's only for the future update. There is no guideline as of now. It's reserved for the future guideline, which is the diseases of the blood and blood forming organs and certain disorders involving the immune mechanism, series D50 to D89. This series have direct codes leading to this, so there are no specific guideline to be followed, so we don't have nothing to read about that. So it's like easy for you when you land into all these D series codes, D50 to D89 codes. In today's video, we're going to see about the chapter 4, which is endocrine, nutritional and metabolic diseases, E00 to E89 series. Even in this endocrine, nutritional and metabolic diseases series, we're not going to cover the entire disorders and diseases in this series, like entire E00 to E89. We're not going to cover that one. There is only guideline for the diabetes mellitus, because other codes in this series are direct leading and you have to follow the footnotes, these exclude, include, and whatever the notes are found below the codes, just follow that and you can land in the correct code. So this diabetes mellitus in this chapter 4 we're going to discuss in today's video. So when coding diabetes mellitus, mostly there will be combination codes. So what is combination code? Combination code means diabetes with some other complication or disease or disorders. So there will be a single code that describes diabetes mellitus with some other complication or condition related with this diabetes mellitus. So most of the diabetes mellitus codes will be a combination codes. So when I say there's a combination code, you should remember the guideline that we already saw in the general coding guidelines. So the combination code, if it exists, you should not code diabetes mellitus unspecified. For example, the patient is diabetic and the patient also has developed neuropathy. In this scenario, you should not code diabetes mellitus unspecified separately and then neuropathy separately, because there is already a combination code exists. There is a code diabetes mellitus with neuropathy. In this scenario, you should opt for the combination code and you should not consider these separate individual codes. This is the combination code rule. We have already learned this in the general coding guidelines, if you can recall them. Also, the patient might have multiple conditions related to this diabetes mellitus. The patient might have diabetes mellitus with various conditions or various different organ system involved. In this scenario, you should code as many codes as possible, capturing all the necessary elements from the documentation. If the doctor has documented all the complication associated with diabetes mellitus, don't choose only one complication related to diabetes mellitus and code. You should code as many codes as possible in order to capture everything from that patient's record. So that is how you should code. So in this scenario, how do you sequence? You should always sequence based on the reason for that particular encounter. So why the patient came into the facility to be treated, why, for what condition the patient is there, the patient is encountered. So you should always choose that as the principal diagnosis. Even the patient has all the diabetes mellitus related conditions, you should choose for what the patient is there for the treatment, and the other diabetes mellitus with other related conditions, you should code as secondary or tertiary diagnosis. So that is how you should sequence. This is also the general coding guideline we already saw. So pro tip here is, even each chapters have some specific guidelines for something, but if you follow the general coding guideline religiously, if you follow that, if you can study and understand and all those general coding guidelines, that is all enough to become a good ICD-10-CM coder. So you can assign as many codes from this category E08 to E13 as needed to identify all of the associated conditions. That is what we saw in this diabetes mellitus introduction. So the first one under diabetes mellitus is the type of diabetes. So there are two types of diabetes, that is type 1 diabetes mellitus and type 2 diabetes mellitus. How you can determine, the doctor will document that one, and also age is not the sole determining factor. If the patient is underage or very young, you cannot predict that the patient is type 1 directly. Most type 1 diabetes will occur before reaching puberty. So that's why type 1 diabetes is also called as juvenile diabetes. But because the patient is very young, that doesn't mean that patient is type 1 diabetes. You can query the physician very well. You can query the physician. Don't think that if you query the physician for asking type 1 or type 2, they'll get mad at you. No. So age is not the sole determining factor, but most type 1 diabetes mellitus come before reaching puberty. So number 2 under diabetes mellitus is type of diabetes mellitus not documented. So if there is diabetes mellitus but it's not documented whether it is type 1 or type 2, you can very well choose the default code type 2 diabetes mellitus. If it's not documented, you can very well choose the default code type 2 diabetes mellitus, which is the E11 series. So the third point under diabetes mellitus is diabetes mellitus and the use of insulin, oral hypoglycemics and injectable non-insulin drugs. Like the patient is already an established diabetes mellitus and the patient is also using an insulin or oral hypoglycemic or injectable non-insulin drugs. In this scenario, if there is no indication of the type, you will choose directly as type 2 diabetes mellitus, which is 11. But there is indication of the insulin intake, like they have mentioned the insulin intake, then you will be coding the long-term current drug therapy, which is Z79 series. You should be coding this one as an additional. So in another scenario, patient is diabetes mellitus and also the patient is taking both oral hypoglycemic drugs and insulin. If the patient is taking oral drug for the diabetes and also an injectable insulin, in this scenario, you will code the diabetes mellitus as a principal diagnosis and then you will code Z79.4, which is the long-term current use of insulin, and also additionally you will be coding Z79.84, which is the long-term current use of oral hypoglycemic drugs. So you should be documenting what type of medications and what mode of medication they are taking. If they are taking single mode or single type of medication, you will code that one. If they take multiple type of medication and multiple type of modes, then you will be coding those. And the other scenario under 3 is if the patient is taking both insulin and an injectable non-insulin anti-diabetic drug. In this scenario, like you already know the drill, right? So you'll code the diabetes mellitus, whatever type it is, and then Z79.4, which is the long-term current use of insulin, and also followed by Z79.85, which is the long-term current use of injectable non-insulin anti-diabetic drug. So this is how you should code when the patient has diabetes mellitus and using insulin or oral hypoglycemic or injectable non-insulin drugs or a combination of these 3. So this is how you should code. Under the same scenario, we have the oral hypoglycemic drugs and an injectable non-insulin anti-diabetic drug. Code the codes accordingly. In this scenario, you will code Z79.84 and also Z79.85. However, they are documented. You should be capturing all the medications, all the mode of medications they are taking. So that is the concept of this point 3. Don't get confused. And also, please note, you should not code Z79.4. What is Z79.4? Z79.4 is long term, look at the bracket, current use of insulin. So it means the patient is not taking it for temporary purpose, like only one shot, only on today. The patient should be taking on long-term basis or as every day or as prescribed by the physician. The patient should have a long-term this medication intake history. Then only you can go for Z79.4 because the definition, the description of the code says so. So if the patient is taking temporarily, like for example, patient comes to an encounter, the patient is not taking the insulin regularly, like the patient is not on long-term use of this insulin. The patient may be having some other oral hypoglycemia or something like that, or the patient is on dietary control. So if that patient is coming to an encounter, and on that scenario, on that encounter, if the patient blood sugar level seems to be very high, in that scenario, if the doctor is giving temporarily an insulin shot, in that case, you will not code the Z79.4 because the description says so. You got my point, right? So whenever you code Z79.4, you should just check what is the, is it for temporary or is it like the patient is taking that for a long term. So moving to the fourth point, diabetes mellitus in pregnancy and gestational diabetes. So for this scenario, we have a separate chapter, that is the diabetes mellitus in pregnancy and the gestational pregnancy induced diabetes. So these things will be covered in that chapter, so we don't want to confuse with that. And just for a hint, I'll tell you, O code will be the primary in this scenario, right? That's it. We'll cover in detail when we go to that chapter. The next point is the fifth one, complications due to insulin pump malfunction. For example, the patient is having an insulin pump installed. So if the patient insulin pump has some malfunctions, there might be underdose of the insulin, like the patient dose, everyday intake of the dose has been reduced automatically because of the malfunction, or sometimes the patient might result in overdose of the insulin because of the malfunction of that. So in this scenario, how we code?
So under diabetes mellitus 5A, we'll see underdose of insulin due to insulin pump failure. So in this scenario, so there is an underdosage of the insulin, there is a regular intake, right? So the dosage has been automatically reduced because of this insulin pump failure. In this case, you'll code the principal diagnosis as T85.6, which is a mechanical complication of other specified internal and external prosthetic devices, implants and grafts. Then followed by that, the secondary diagnosis will be T38.3x6, which is the underdosing of insulin and oral hypoglycemic anti-diabetic drugs. So these two diagnoses should be principal and secondary. Additionally, you will code the type of diabetes, and if there is any other complication because of this underdosing, any other side effects because of this underdose, you will be coding them as well. So this is how you should code the underdosing scenario. The next one here we have the B, overdose of insulin due to insulin pump failure. In this scenario, the principal diagnosis will be T85.6 series, which is the mechanical complication of other specified internal and external prosthetic devices, implants and grafts. Then followed by the secondary diagnosis T38.3x1, which is poisoning by insulin and oral hypoglycemic anti-diabetic drugs, accidental, unintentional. So when there is an underdose, we call that as underdose only. When there is an overdose of the prescribed medication, we call it as poisoning. So in this case of poisoning, we should mention whether it is accidental, that is unintentional, or intentional. Whenever you find the documentation that has poisoning documented, you should find out whether it is intentional or unintentional. But in this scenario, it is because of the insulin pump malfunction, which obviously it is unintentional. The patient didn't meant to take that one as overdose. So we'll code it as unintentional, and as usual followed by the type of diabetes, and if any other complication has arisen because of this overdose, you will code that complication code as well. The next one under diabetes mellitus is secondary diabetes mellitus, that is number 6. So what is secondary diabetes mellitus? We saw the diabetes mellitus, now this is on a secondary diabetes mellitus. So secondary diabetes mellitus means it is not the direct condition, it is always caused by another condition or event. Like the patient has another condition or a disease or a neoplasm or some effects of drugs or some poisoning. For example, cystic fibrosis, malignant neoplasm of pancreas, or the patient had a pancreatectomy already. Then there are some adverse effect of drugs or poisoning. In this scenario, these conditions or these events led to diabetes because the patient's pancreas cannot secrete insulin. So in this scenario, it is called as secondary diabetes. So diabetes directly from the lifestyle or hereditary is considered as direct diabetes mellitus. Those that are caused by another condition or event is called as secondary diabetes. So when coding secondary diabetes, you should always look for what is the causal reason for this secondary diabetes to occur. So that is the main point you should remember. So when you're coding secondary diabetes, you should know why this patient has this diabetes, what is the causal reason. Then only you can directly go and choose secondary diabetes mellitus. So if there is no proper reason like why the patient has secondary diabetes mellitus, you can always query your physician. And the physician, if he gives some reasons, then go for that valid reason, secondary diabetes mellitus. If there is no reason by mistake, then you can go for the diabetes mellitus, which is the direct one. So the code categories under secondary diabetes mellitus are E08, which is DM due to underlying condition, E09, drug or chemical induced diabetes mellitus, E13 other specified diabetes mellitus. So these scenarios you should code for the secondary diabetes mellitus. Then under 6th secondary diabetes mellitus, the first one A, secondary DM and the use of insulin, oral hypoglycemic drugs or injectable non-insulin drugs. This one, this exact one we just saw in the diabetes mellitus. This one, use of insulin, oral hypoglycemic drugs or injectable non-insulin drugs. The guideline of this and that are same. So remember, this guideline and that guideline are same. So I'll repeat it. So it will be a refresher for you. So first scenario, both oral and hypoglycemic drugs and insulin are given. So you'll be coding Z90.4, then Z79.84 along with secondary diabetes mellitus. Then the other scenario, both insulin and an injectable non-insulin anti-diabetic drug. So in this scenario, you'll code Z79.4 along with Z79.85. I'm not going to explain what is the meaning of the code because this is the same thing we already saw. So you'll code both of these along with the secondary diabetes mellitus. So these two things you should code along with the secondary diabetes mellitus. The third one that we already know, both oral hypoglycemic drugs and an injectable non-insulin anti-diabetic drug, you'll be coding Z79.84 and Z79.85 likewise. So this the pattern you should be coding. And in that previous scenario with diabetes mellitus and these drugs, I insisted that Z79.4 should not be assigned if insulin is given temporarily to bring the secondary diabetic patient's blood sugar under control during an encounter. So if it's used for temporary, like for that instance only, the patient is not taking like currently as long term, you should not code Z79.4. Why? Because the code description says so. So under 6th one, secondary diabetes mellitus, the B point, assigning and sequencing secondary diabetes codes and its causes. So the sequencing of secondary diabetes codes in relation to the codes for the cause of diabetes is based on the tabular list instruction. So if you want to code for secondary diabetes, you should always go and check the tabular list in the ICD-10-CM book, E08 series, E09 and E13 series. Go there, see what the instruction is giving. If it's giving like code first, go for that code first code. If it's telling like code additional, then code it as additional. So so there is nothing guideline specific for this, but follow the instruction that is there in these code categories. So that is as simple as that, right? It's very easy, it's very straightforward. It not only applies to this, it applies to the entire coding. Whenever you choose a code diagnosis, this is a pro tip here. Whenever you choose a diagnosis, always go to the tabular list, go to that category of the codes and see anything written below that. Like see what is there. Is there any excludes, includes, or is there any code first, or is there any additional thing? Whatever notes, or is there any include notes? Whatever is there, just read it and go by that. So under this B number 1, secondary DM due to pancreatectomy. So what is pancreatectomy? Pancreatectomy means the patient has a surgically removal of a part of pancreas or all of the pancreas, the total of the pancreas. So in this case what happened? There will be lack of insulin. So in this scenario, we will be coding the first one, E89.1, which is post-procedural hypoinsulinemia, because there is an hypo means low, insulin means insulinemia means blood. So low level of insulin in the blood post-procedure, that is after a procedure. That is, in this scenario, it is after a pancreatectomy. So you'll be coding E89.1. This is where your suffix, prefix, and the root word comes to play. So like this one only, like this way only, you can understand the medical terminologies easily. If you want to learn about the prefix, suffix, and the root words, I have already posted a few videos on that. You can very well go and check that one. I'll also put it in the description below for you. So the principal diagnosis here is E89.1, post-procedural hypoinsulinemia, followed by E13, which is the other specified DM, that is secondary diabetes, then followed by Z90.41, which is the acquired absence of pancreas. The pancreas is not there. It's surgically removed, so you'll make it as acquired absence. So the second scenario under B, assigning and sequencing secondary diabetes codes and its causes, secondary diabetes due to drugs. So secondary diabetes may be caused by an adverse effect of correctly administered medications poisoning or sequelae of poisoning. So there is, because of a drug adverse effect, it causes secondary diabetes. There is lack of insulin in the blood. In this scenario, what you will do, you will follow the section 19 for adverse effects of poisoning and section of 20 for external cause code reporting. We'll be discussing this in detail when we come to that 19 chapter section. If you already know the basics of the coding, if you already know the guidelines, the general coding guidelines, the pattern will fall the same throughout the chapter specific guidelines. There's nothing to worry about. Hope this video is useful and informative for you. If you found this video to be useful, please hit the like button and please share this with your coding friends or other friends who are pursuing coding. And if you're new to this channel, please subscribe and hit the notification icon so you'll not miss any of my future video. This is Surya Johnson, your medical coding guide.